So, hello viewers, welcome to another session. And today's topic is very interesting. Today's topic is amyloidosis. Now, what is amyloidosis? So, amyloidosis is a rare and potentially serious medical condition, and this condition is caused by abnormal buildup of amyloid proteins. So, what is a amyloid protein? To understand this, we have to understand the normal protein structure first. So, proteins are basically comprised of different units of amino acids. So, these amino acids they has a specific sequence to form a certain protein, and after the incorporation of specific amino acids in a specific sequence, they again folds in certain way, and this is called the secondary structure. So the amino acid sequence that is known as the primary structure, the secondary folds are the secondary structure. Now again they fold to form tertiary structure and finally the quaternary structures. So all these primary, secondary, tertiary and quaternary structures are specific for a protein. Now what happens in case of amyloidosis? Now if some proteins are misfolded. Misfolded means I have already told you that the proteins has certain foldings in form of secondary structure, tertiary structure, or quaternary structure. Now, suppose this is a normal protein which has a specific folding, but if due to some mutation or some other process there is a misfolding of these proteins, so the structure is altered, and these misfolded proteins they basically form clumps, and these clumps they finally form some fibrillar structures, and these fibrils are known as the amyloid fibrils, and these fibrils they deposit in different organs, and thereby depositing in different organs they can cause organ dysfunction. So this is the basic mechanism behind amyloidosis. These abnormal misfolded proteins they can accumulate in various parts of the body, and they interfere with the normal organ functions. So this is a process by which there is misfolding of normal proteins, and as a result the normal structure of a protein is lost, and these abnormal proteins they gets deposited in various organs or tissues of our body, and they cause dysfunction of different organs or tissues. Now what are the organs which are commonly affected in this condition? The commonly affected organs are heart, kidney, liver, nerves. Also any tissue can be affected by this disease or entity. Now let's talk about the types of amyloidosis. Now there is one entity called AL amyloidosis. Now AL or primary, which is also known as the primary amyloidosis. Now what is primary amyloidosis? It is caused by an abnormal plasma cell production, and these plasma cells they produce excess amount of light chains, that form amyloid deposits. Now, first, what is plasma cells? As you can know that in our body there are various types of blood corpuscles or blood cells, and among them one is lymphocyte. And these plasma cells, these are basically a mature form of b lymphocyte. b lymphocyte So these plasma cells, they are basically mature b lymphocytes, and these plasma cells, if they produce excess amount of light chain. Now what is light chain? light chain are Light chains are a part of normal antibody. So this is a structure of antibody, and this y shaped structure is a complete antibody. And in this green part is a heavy chain, and this blue part, this is a light chain. So every antibody has two heavy chains and two light chains. And in case of amyloidosis, from these plasma cells, they produce excess of light chains, and these excess amount of light chains they deposit as amyloid. And so that's why this condition is associated with multiple myeloma. Multiple myeloma is a type of neoplasm of plasma cells. Here there is proliferation of the plasma cells within bone marrow. These are the plasma cells within bone marrow. There is excess production of plasma cells within the marrow, and these plasma cells, they can produce excess of light chains, and this excess amount of light chains, they form this kind of amyloid fibrils. And these fibrils, they deposit in various tissues like heart, kidney, liver, or nerves, and they form AL amyloidosis or primary amyloidosis. Now coming to the next type of amyloidosis, that is AA amyloidosis, which is also known as secondary amyloidosis. This condition, it is commonly associated with chronic inflammation, and various chronic inflammatory conditions like rheumatoid arthritis, inflammatory bowel disease, or chronic infections. Any of these chronic inflammatory condition, they can produce secondary amyloidosis. So it can also affect kidney, liver, or spleen. Now coming to the third type of amyloidosis, that is the hereditary or familial amyloidosis. What happens here? It is caused by a mutation in the transthyretin gene commonly. This transthyretin gene, so this tetramer of the transthyretin, that is commonly produced from liver, and due to some mutation there is misfolding of this transthyretin structure, and this abnormal structures, they form amyloid fibrils, and this type of fibrils, they are deposited commonly within the heart muscle or myocardium, causing cardiac dysfunctions. So here the most common organ that is affected in uh, hereditary amyloidosis, that is heart. There is another type of uh, amyloidosis that is known as dialysis associated amyloidosis. It occurs in patients undergoing long term dialysis And there is accumulation of one protein called beta 2 microglobulin. Now, what is beta 2 microglobulin? These are very small proteins that normally found on the cell surface, and these proteins, they are basically component of mean histocompatibility complex that is present on the cell surface, which is uh, uh, associated with antigenic expression, and those antigenic expression, those antigens are basically they are projected towards the lymphocytes, and thereby it helps uh, our lymphocytes to identify foreign antigen and take actions against them. So this is another type of amyloidosis. Also, we have to remember that there is one wild type or senile type transthyretin amyloidosis that is not due to any kind of mutation but some unknown process. Here, the abnormal transthyretin molecules, they are deposited in mainly in liver, and they produce symptoms. Now, what are the symptoms? These abnormal proteins, they affect various tissues in our body, and they produce different symptoms. If it affects heart, there is heart failure, arrhythmias or abnormal rhythm. If it affects kidney, then it can produce proteinuria. That means there is loss of protein from urine. It can also lead to kidney failure. If it is deposited in the nervous system, that can cause peripheral neuropathy or carpal tunnel syndrome. That is another characteristic feature of amyloidosis. Also, liver and spleen can be enlarged due to deposition of this abnormal protein. There is generalized fatigue, weight loss, swelling, and bruising. Another points that is also important. This condition that can also cause macroglossia. That means the enlargement of tongue due to deposition of this abnormal protein within the tongue tissue. Also, there is one condition called raccoon eye. That means there is periorbital ecchymosis. This can also be a presentation of amyloidosis. So now let's come to the methods of diagnosis of amyloidosis. Now, how this condition is diagnosed? It can be diagnosed with some blood or urine tests to detect abnormal proteins. We can do blood or urine electrophoresis, immunofixation, or free light chain ratio. These uh, tests, they help to find if there is any abnormal protein formation or if there is any abnormal light chains that is being circulated in blood or that is being excreted in urine. Also, we can do some biopsy from different tissues, from fat pad biopsy, kidney or heart biopsy. Also, it can be done from rectal biopsy or lip biopsy. What is fat biopsy? This is small amount of tissue from the parietal terminal wall is taken out and it is sent for histopathological examination. Some special stains like Congo red stain or thioflavin T, these stains are used to identify uh, this abnormal protein or amyloid, and on polarized microscopy after staining with the Congo red stain, these abnormal amyloid fibrils, they show a specific apple green birefringence, which is characteristic feature of amyloidosis. Also, genetic testing can be done in some difficult cases to identify what the specific mutation, if there is any kind of specific mutation. So these are the diagnostic modalities. Now coming to the treatment. In case of AL amyloidosis, which is due to production of the abnormal amyloid proteins from plasma cells, this can be treated with chemotherapy or stem cell transplantation. Usually, in case of chemotherapy, there is a combination of chemoimmunotherapy is used in chemotherapy. Cyclophosphamide, bortezomib like medications are commonly used. Excuse me. And in immunotherapy, there is a drug called uh, there is a drug called daratumumab, which is one monoclonal antibody against the CD38 molecule that is present on the plasma cells. So, chemoimmunotherapy is another option. Next is the stem cell transplantation. Now, how stem cell transplantation helps in uh, correcting this condition? So, in case of stem cell transplantation, first chemotherapy or different treatment modalities given to the patients to uh, control the disease. After controlling of the disease, the stem cells are removed from the patients with the process called apheresis, and then after collection of the stem cells, the uh, patient is subjected with the chemotherapeutic drugs to eliminate the cancer cells or the abnormal cells present within his or her body. And after clearing of those abnormal cells, the stem cells which was previously collected, that was again reinfused within the patient's body, and thereby clearing the abnormal cells, and also it helps uh, to get rid of this condition. Now, in case of AA amyloidosis or secondary amyloidosis, we have to treat the primary inflammatory condition. And if we keep the primary inflammatory condition under control, then there will be less formation of these abnormal proteins, and there will be the the disease burden will be decrease. Now, regarding hereditary amyloidosis, in treatment of hereditary amyloidosis, there is the various gene targeted therapies or liver transplantation, as the transthyretin molecules, they are mainly produced from the liver. So if you transplant liver, so the abnormal transthyretin molecules will not be produced, and that is another treatment option. And also we should also keep in mind that we have to give a proper supportive care to the patient. Especially we have to give sometimes diuretics if there is fluid accumulation within the body, or there is features of the heart failure. And we have to conduct dialysis if there is substantial amount of renal impairment. Now the prognosis, first thing that I want to convey, that is a it is a serious type of disease, and it can involve various organs, but there are therapies to control this condition. But if a patient is neglected, then there is a rapid progression, and so it is better to identify this condition as early as possible and to initiate the therapy as early as possible. So this is about amyloidosis. If you have any question, then feel free to ask me in the comment section below. And if you feel this video is helpful to you, then you can also like this video. You can also share this video with your friends. And if you think that this kind of contents may be helpful for you, then please consider subscribing to my channel. Thanks for watching.